Hello, I am Matthew Kurien. I am a GI Research Fellow at the Royal Hampshire Hospital in Sheffield, England. Along with my fellow co-authors, we are absolutely delighted to have our paper Capsule Endoscopy in Adult Celiac Disease, a potential role in equivocal cases, accepted for publication in Gastrointestinal Endoscopy. Capsule endoscopy is now widely established as a means of assessing the small bowel. When compared to other endoscopic techniques such as esophagogastroduodenoscopy, push enteroscopy or double balloon enteroscopy, for example, it has advantages in being minimally invasive and well tolerated. Capsule endoscopy has now got defined roles in conditions such as obscure gastrointestinal bleeding, inflammatory bowel disease and polyposis syndromes, but there is an increasing interest in what capsule endoscopy may offer in the area of celiac disease. As a diagnostic tool, capsule endoscopy has been shown in a number of recent studies to have high sensitivity and specificity for the detection of celiac disease. It may represent a reasonable alternative to what is currently used as the gold standard test, which is an esophagogastroduodenoscopy and small bowel biopsies aiming to demonstrate the presence of villus atrophy. Now, whilst capsule endoscopy is clearly limited in that it cannot acquire biopsy specimens for histological interpretation, its high magnification power and its ability to view the entire small bowel has clear merits, enabling accurate identification of endoscopic markers of villus atrophy such as reduction of Kurien folds, scalloping and a mosaic pattern. Another potential role being advocated for capsule endoscopy in celiac disease is in the management of refractory cases, with studies highlighting that capsule endoscopy may improve diagnostic yield in these cases. Currently, there is a paucity of work evaluating equivocal cases of celiac disease. This study that we are presenting in gastrointestinal endoscopy builds on our previous work in this area and adds to the literature by being the first to systematically evaluate the role of capsule endoscopy in equivocal cases. In this prospective single-centre study, we evaluate 62 equivocal cases. These individuals were patients with suspected celiac disease but who had equivocal histological or serological findings after esophagogastroduodenoscopy and duodenal biopsies. Of these patients, 32 had antibody-negative villus atrophy, with the remaining 30 having either MARSH1 or MARSH2 changes. Diagnostic yield of capsule endoscopy in this group of patients was then compared with a separate cohort of 69 biopsy-proven celiac disease patients with persisting symptoms. We identified in this study that in patients with antibody-negative villus atrophy, capsule endoscopy secured a diagnosis of celiac disease or Crohn's disease in 28%. This was significantly higher than the diagnostic yield identified in the other equivocal cases with either MARSH1 or MARSH2 changes. When looking at the cohort of celiac disease patients with persisting symptoms, capsule endoscopy identified significant findings in 12%. These included cases of enteropathy-associated lymphoma, type 1 refractory disease and ulcerative jejunitis. However, and importantly to emphasise, this yield in the non-responsive group was significantly lower than the diagnostic yield seen in the patients with antibody-negative villus atrophy. Now, our work is limited by a lack of an adequate control group in either the equivocal or persisting symptoms group, and also by the relatively small sample size and the academic medical setting in which this study was undertaken. Nevertheless, we feel that our study highlights important findings. So in conclusion, whilst capsule endoscopy is by no means the gold standard test in celiac disease, our study demonstrates that the diagnostic yield in patients with antibody-negative villus atrophy is greater than that seen in patients with celiac disease and persisting symptoms. Therefore, we would advocate the use of capsule endoscopy in equivocal cases to help establish a diagnosis.